Hello, Dr. Carlo Oger, board-certified emergency physician. In this patient education video, we're going to talk about allergies. It will soon be spring in the south. And if you suffer from allergies, you want to learn as much as possible to prevent the complications and horrible symptoms of allergies. So let's get to it. Spring allergies are triggered as trees start to bloom and billions of pollen grains are released into the air, causing susceptible individuals to develop allergic rhinitis or hay fever. In this patient, the pollen causes degranulation of mast cells, which contain inflammatory mediators like histamine and other allergy-causing chemicals. This process is clinically represented by the following symptoms: red, watery, and itchy eyes, sneezing, runny nose, post-nasal drip, itchy or scratchy throat, sinus headaches, and the feeling of sinus being full. In addition to these symptoms, inflammatory mediators lead to swelling and hypertrophy of the nasal turbinates, as well as possible loss of taste and smell. Pollen can also trigger asthma attacks with inflammatory mediators from the degranulated mast cells causing airway inflammation, bronchial hyperresponsiveness, and airflow obstruction, the last being a consequence of factors such as acute bronchoconstrictions, airway edema, and mucus plug formation. Pollen initiates an allergic reaction only in person with allergic antibodies or immunoglobulin E, IgE specifically. And this is specific to that specific allergen or pollen. Mast cells in the nasal and respiratory passages, the sinuses, the throat, and the eyes are sensitized to IgE, ultimately releasing histamine and other inflammatory mediators which cause sneezing, coughing, wheezing, and tearing of the eyes. The use of oral antihistamines, corticosteroids, antihistamine nasal spray, inhalant corticosteroids, and antihistamine and mast cell stabilizer eye drops may help mitigate these symptoms. But of course, you need a prescription for most of these medications. Family history plays a significant role in an individual's predisposition to allergies. If one parent has allergies, then it's likely that at least one of multiple children will also have them. The likelihood is greater if allergies affect both parents. Allergic conjunctivitis is characterized by irritation or redness of the eyes and is common in allergy season. Like the nasal mucosa, the conjunctiva of the eye is a mucosal surface. Consequently, pollen and other allergens that trigger allergic rhinitis can also cause allergic conjunctivitis. Contact between an allergen like pollen and the eyes causes the ocular mast cells to release these inflammatory mediators we've been talking about, including histamine, a reaction that can be prevented by using eye drops containing antihistamines, mast cell stabilizers, or combination of both. A lot of patients think they just have a cold or that they have allergies and they mix that. A cold can often be differentiated from allergies on the basis of the length and timing of the symptoms. A cold commonly caused by rhinovirus usually lasts 7-10 days. If the symptoms continue beyond the 10-day mark and develop on a recurring basis, this may indicate the presence of an allergic condition. Allergy is also indicated if symptoms recur at the same time every year. Despite the similarities in presentation, asthma and bronchitis can be differentiated clinically. In asthma, chest radiograph may show hyperinflated lungs, whereas physical examination may reveal wheezing caused by airway narrowing that inhibits respiratory airflow. Symptoms also include cough, chest tightness, or congestion. Bronchitis is the inflammation of your bronchial tubes. Mucus buildup interferes with the movement of air in and out of your lungs, and wheezing, coughing, sputum production may occur. Usually bronchitis is viral, but it can also be bacterial, requiring antibiotics. Inadequate allergy treatment can result in complications. Allergic rhinitis, for example, can lead to the following: chronic or even acute sinusitis. This can result when the inflamed nasal turbinates block the natural drainage of the sinuses through the osteomeatal complex. Otitis media. This is believed to occur when the inflamed nasal passages interfere with the patency of the eustachian tube, a tube that connects the ear to the throat, therefore backing up inflammation and possible infection. It can also cause sleep disturbances, chronic fatigue, headache, and throat irritation. There's also evidence that allergic rhinitis, if not controlled, can worsen inflammation related to asthma. Allergy symptoms can also be managed with nasal decongestions. Patients should be warned, however, that nasal decongestion sprays, i.e. topical vasoconstrictive medications, can cause inflammation, rhinitis medicamentosa, and even nosebleeds. The decongestion pseudoephedrine can be taken orally but has a tendency to increase your blood pressure, and it should therefore only be used with care if you have problems with blood pressure. Nasal sinus irrigation with physiologic saline placed in a plastic syringe or a plastic rinse bottle can also aid in sinus drainage. Allergy immunotherapy, that is the use of allergy shots, can reduce the sensitivity to allergens. Initially, patients receive a gradually increasing injected dose of allergens, which builds up a maintenance dose. It is hypothesized that the injected allergens elicit a protective immune response in the patient with increasing his or her levels of IgG4 and regulatory T cells. This allows the individual's immune system to respond to an allergen in the environment rapidly and aggressively enough to prevent the activation of an allergic cascade of events. A course of allergy shots can take 3 to 5 years. The most important side effect that can arise from this kind of therapy is an anaphylactic event. Consequently, after you receive an allergy shot, patients are required to remain under observation in the doctor's office for about 30 minutes. A newer treatment is called sublingual immunotherapy, or SLIT, in which the allergen is placed in a tablet and is put under the tongue. It is believed that it's nearly as effective as allergy shot therapy, and it's definitely something you should talk to your primary doctor about. Allergy prevention. Measures can include the following. Limit the exposure to pollen and other allergens by remaining indoors on days when the pollen count is high or air quality is poor. Keeping windows closed during the morning. Pollen counts tend to be high at this time of the day. When driving, put the car's ventilation in recirculation mode or using the air conditioner, which can limit the amount of pollen inside the vehicle. Here are other tips and tricks to treat or deal with the symptoms of allergies. Don't touch or rub your nose. Wash your hands often with soap and water to decrease the amount of allergens that you pick up. Use a vacuum with a certified asthma and allergy-friendly filter to reduce the allergen exposure while vacuuming. Wash your bed liners and pillowcases in hot water and detergent to reduce the allergens. Use dust mite-proof covers for pillows, comforter, duvets, mattress, and box springs. Keep pets out of the bedroom to decrease pet dander allergen in your bedding. Wear sunglasses and wide-brimmed hats to reduce the pollen getting into your eyes, and keep your windows closed during high pollen and mold seasons. And use the air conditioner in your car and your home, and if you can, change the filters in your air conditioners to those certified for asthma and allergies. Well, that's it for today. My name is Dr. Carlo Oger. I'm a board-certified emergency physician, and if you get allergies every year, same time, you probably know what works for you. Sometimes you need a round of steroids or a Decadron shot, or you need a specific type of antihistamine like Claritin D or Allegra or whatever. If you're in the need for these prescriptions and don't want to waste your time going to the doctor or emergency department, then I am available at sesamecare.com, where you can schedule an appointment with me to get these prescriptions you need to help you deal with seasonal allergies. It was a pleasure being with you today in this video. I will see you in the next one. Bye-bye.